Hi, I'm Dr. Matthew Weiner. I'm author of A Pound of Cure and How Weight Loss Surgery Really Works, and also the soon-to-be-published Bariatric Diet Guide and Cookbook. And today I'm going to talk a little bit about self-paying for your weight loss surgery. So why would you pay for your surgery instead of using your insurance? Well, the first is about 5% of all health insurance policies in the US have what's known as a bariatric exclusion, which means they don't pay for or cover bariatric surgery. So if you're in that unfortunate group of people whose employers have decided to exclude bariatric surgery as a cost-saving method in their HR department, then you have two options. You can either pay for the surgery yourself, or if you're in a small enough company, I've had some patients who've had some success discussing this with their HR department and with their bosses and getting them to change their policy in the next coverage year so that they do include surgery. So this is something like a menu item that when the HR department is sitting down and talking to the health insurance companies, they'll say, yeah, let's cover bariatric surgery or let's not cover it, and that's where these exclusions come from. You save a little bit of money, but if you have employees who aren't happy because their insurance policy doesn't provide the services that they really desperately need, then sometimes good companies who value their employees will make some changes. You may not have health insurance at all, in which case, of course, your only option is to self-pay. You may not meet your insurance company's criteria. There's kind of two groups of people who fall into this category. The first is low BMI patients, and I've done lots of surgery on patients with BMIs between 30 to 35. Our NIH health criteria, which is a BMI between 35 and 40 with at least one health condition related to obesity, or a BMI of 40, which about 98% of health insurance companies use as a criteria for covering bariatric surgery. These were created in 1998. Now, 25 years later, we have tons of data that demonstrate the value of operating and doing weight loss surgery on patients who have a BMI between 30 to 35, but we really haven't had any significant change in the coverage criteria. There are some healthcare companies that will create very, very restrictive criteria for bariatric surgery. So it's beyond the traditional NIH criteria. They may say you have to have uncontrolled blood pressure despite maximal treatment with medications, or put other long and arduous processes in front of you in order to qualify for surgery, which give them many options to deny you. And then the final group is someone who really just doesn't want to wait for the 3, 6, sometimes 12-month process or go through all the testing. They may have the financial means where spending the money for the surgery is worth the time saving, and they may elect to self-pay for that reason. I've operated on people who've really fit into every single one of these categories, and certainly this is who we're going to be doing these self-pay surgeries on. So the first question when you're exploring self-pay surgery is how much? And really what's happened is to some degree, you get what you pay for. I think in the US, particularly with hospitals, we do have some discrepancies between the cost of the surgery and the value of the surgery. But when it comes to kind of traveling internationally, typically Mexico is the most common place that people in the US will go. We're looking at about $4,000 for a sleeve and $5,000 for a bypass, and there's some variation there. You may find some cheaper programs, you may find some more expensive programs, and there's a tremendous variation in the quality. There are some very good hospitals that run some high quality programs there, but then there's also some programs. I had one patient who unfortunately made a bad decision and went down to Mexico, and she described it almost as like an open air gymnasium, and there was another patient maybe about 20 feet away also having surgery in the same room. And so I think some of those things which would never be allowed in the United States can happen in Mexico where there's less regulation. That's not to say all programs are like that, but it's sometimes very difficult to know what you're signing up for just based on the website. Then in the US, surgery can either be performed in an ambulatory surgery center or in a hospital. And these are very different structures. An ambulatory surgery center is usually a relatively small building that's really just dedicated to surgery. Oftentimes there's other office buildings in them, and they don't have the same resources as a hospital. So there's no blood bank on site. The number of staff available for emergencies is going to be much less than you would see in the hospital. And so for that reason, ambulatory surgery centers typically restrict what types of surgeries they'll do and what types of patients they'll do these surgeries on. So only really lower risk patients are going to qualify for an ambulatory surgery center. But because ambulatory surgery centers are kind of less encompassing, they typically are less expensive. And in the US, you'll see a sleeve for somewhere between $8,000 to $12,000 in an ambulatory surgery center. Sometimes that covers an overnight stay, sometimes it doesn't. That's an important thing to find out before you're making any decisions about self-pay surgery. Gastric bypasses are generally not performed in a ambulatory surgery center just because they're more complex surgery with a little bit more risk. There's more moving parts and more required to perform these surgeries safely, and ambulatory surgery centers often don't have those resources available. Not to say that they can't be done safely in an ambulatory surgery center, and I bet there are some places in the US that do gastric bypass safely in an ambulatory surgery center, but it's certainly something to question if that's what you're exploring. When we get into hospitals, that's where we really get kind of a breakdown in the cost to value. There are some hospitals that work with the surgeons and have come up with a relatively low price or reasonable price where they're not trying to make a ton of money off of self-pay surgery. And we'll see numbers like in the $13,000 to $15,000 range for a sleeve, and gastric bypass maybe $15,000 to $18,000. There's other hospitals that are basically like, we don't really care about self-pay surgery. We're just doing insurance. So if anybody inquires, we're going to tell them it's $30,000 for a sleeve, $40,000 for a gastric bypass. And I've heard a lot of people get some really kind of crazy numbers for self-pay surgery in US hospitals. It doesn't mean they're safer hospitals by any means, and that by paying $30,000 or $40,000 you're getting twice as much value as you would at another hospital across town that's come up with an affordable self-pay price. This is really just something that the hospital administrators have decided they're either going to do or not do. So if you get kind of random pricing, especially some very high prices for self-pay surgery in a hospital, then that's certainly something you can shop around. Often within the same town, you'll find sometimes 50% differences in the prices from one hospital to the other. And it doesn't mean that the more expensive hospital is better. Our hospital in Tucson offers prices really at the lower end of these numbers, and we've worked with our administration. I do a lot of self-pay surgery, and I think our prices are fair, and we do it in a hospital, certified center of excellence, so we're really not cutting any corners. And that's how I like to do self-pay surgery. There are financing options. No practices that I know of will actually offer the financing themselves and essentially take the risk and allow you to make payments to the practice. They all use third parties because honestly, surgery practices are not banks and don't have the financial resources to act like a bank. So the four that I've seen with some frequency that are used are Care Credit and Prosper, United Medical Credit, and e-financing solutions. Care Credit and Prosper are definitely the two most common. You're not going to get any great interest rates here, and they tend to be pretty restrictive because unlike a car that they can repossess and kind of get some of the money back, you can't repossess a surgery. So depending on what your credit rating is and how much money you put down, you may see some reasonable terms, you may see some unreasonable terms as you seek out financing for these surgeries. An important thing to know is that the cost of your surgery may actually be tax deductible, which really, depending on what your tax bracket is, reduces the actual cost to you by about 25%. It is restricted. It has to be a certain percentage of your income. So if you have a relatively high income, then this may not meet the criteria and be a high enough percentage of your total income to be tax deductible. I'm not an accountant, so anything I say about this really should be taken with a grain of salt. But if this is something that is important to you, you should contact your accountant or a certified accountant to make sure that you are going to be able to take advantage of that benefit. When shopping around for self-pay surgery, it's really important to ask what's included in the whole cost here, right? Do you get to stay overnight or not? Is that something that's important to you? I've done outpatient sleeve surgery, and you can make it work, but I will tell you, it's a rough night. And you know, there are very few complications after a sleeve, but if you had bleeding and you're at home, the outcomes are going to be very different than if you have bleeding and you're in a hospital, where we can rescue you and resuscitate you and give you a pint of blood quickly and do the things that are necessary in the rare case that you have bleeding after surgery. And the truth is, there's no surgeons out there that have a 0% rate of bleeding after surgery, myself included. This is an inherent risk of the surgery. We give you blood thinners before. The risk is very low. This isn't something I deal with on a weekly, monthly, or practically even yearly basis, but it is something I've seen before and will probably see again in the future. That's why I choose to do my self-pay surgery in a hospital, because I know that if that, God forbid, that does happen, we're going to be able to rescue the patient and things are going to be okay. If that happens at home, it doesn't. And this really depends on your financial situation, because you can save some money by not staying overnight, and also on your risk tolerance. Some people are fine with a 0.5% or a 0.25% risk. Other people are not. Are there any hidden costs? For instance, the pathology. If you have a sleeve and the stomach gets sent off to the pathologist, are you going to get a bill for $500 from the pathologist for looking at your stomach? So there's a lot of uncertainty about this, and this is something you have to get up front. What's involved with aftercare? Do you have 30 days of aftercare after your surgery? 90 days? A year? What's included in the self-pay price? Who's going to do that aftercare? Is it going to be done by a nurse practitioner? Is it going to be done through an online support group? Is it going to be done by your surgeon? And understanding how that all works is something that also is important, because there's a big difference between an online support group versus a one-on-one meeting with your surgeon, I think, in terms of the value you're going to get in your aftercare. We all know aftercare is important. Is there a hospitalist? I have a hospitalist or a medical doctor see all of my patients after surgery. I do that for my insurance patients, so I don't want to cut any costs on my self-pay patients, so we offer that as well. And that allows for them to review your medications. There's a second set of eyes on the patient at all time to make sure that they're able to be cared for and that all of our bases are covered. We're not missing anything. We're not perhaps we're not missing an adjustment on your medication, which could cause your blood pressure to go low after surgery or anything else like that. Are there differences between what the care that's provided if you self-pay or if you use insurance? When you're doing insurance, it's kind of like, well, let's just do everything because we all have a deductible. Once you hit that deductible, everything after that is pretty much covered. So having additional consultations come in or the pathologist review the specimen, those are essentially afterthoughts. When you're doing self-pay surgery, each of those are additional costs. So is there any difference between what the surgeon does for self-pay patients versus insurance-paying patients? I try to make that difference as small as possible. And some programs may kind of cut a lot of corners. And with surgery, especially these surgeries where we're looking at 1% and 2% serious complication rates for major abdominal surgeries, we get that by dotting every I and crossing every T. And I always feel uncomfortable whenever I start to cut a little bit of corner, because it's inevitably it's going to make that 1% go to 1.5%. And even though that's a small number, that's a person. I operate on a lot of people, and that is a person who has a complication, and to me that's just not acceptable. What about preoperative evaluations? All sleeve gastrectomy patients, in my opinion, should have an endoscopy before surgery. How's that going to be paid for? Can we get your insurance company to pay for it, which typically we can? Or is this something that you're going to have to pay an additional cost for? And what's the cost for a self-pay endoscopy? What if they take biopsies from that? There's a lot to ask about and a lot to cover. Medical clearances, if you have to see a cardiologist or a medical doctor, is that included in the cost or not? What about any blood work before or after surgery? Is that included as well? So these are all questions that you really want to have some answers to, and a program that does a lot of self-pay surgery is going to be able to spell those out for you. That's not going to be, well, let me think about that. Hold on, I got to ask a couple of questions. if a program is well designed and well set up to support self-pay surgery, then they're going to be able to answer every single one of those questions. In my practice, we've worked that all out, and you're going to get a list of exactly what is covered and what is not, and we'll have plans for how we handle the things that are not covered. And then post-op medications. Truthfully, this is probably the least important thing. I prescribe 4 medications after surgery. I think they're each about $7 to $8 a piece. So that's not going to be an expensive part, but it's, again, something to know about. Complications. This is really the Achilles heel of self-pay surgery. They are few and far between, as we said, but they happen. If they happen, complications are incredibly stressful when they happen, for the surgeon, for the patient, of course, for the patient's family. But when we throw this extra piece where this could also financially bankrupt you, then it becomes even more difficult to deal with. The first and most important thing about choosing a self-pay surgery center or surgeon is to make sure that this is a surgeon with a low complication rate. And they have to be someone who's experienced, who's done a lot of surgeries, who really monitors their outcomes closely, who can talk honestly and openly with you about their complication rate. And I think that's a really important thing, the most important thing, because if you have all your bases covered, but the surgeon has a really high complication rate, that's still not going to be worth whatever arrangements you've made to adjust for the complication rate. You should know what your risk is. Some patients are higher risk than others. This calculator, which I use in my practice daily, and I run through my patients through it actually at least twice during their preoperative process, is michiganbsc.org. This is a database of over 100,000 people. When I practiced in Detroit, I was part of these. My patients were part of those 100,000 patients, and my data is in there. It's an excellent, excellent, high-quality database, and it's allows you to put in your factors. It's a little more geared for medical people, but no logins required. It's open to the public, and you can basically click off, I have high blood pressure, I have diabetes, I smoke, I don't smoke, I've had a history of a blood clot, and it will tell you what your actual 30-day complication risk is. And so knowing what your risk is an important part of kind of determining. If your numbers come out really high, like 5%, then self-pay surgery is probably not for you. Hopefully your surgeon would figure that out, but unfortunately, especially if you're traveling out of the country, that's often not considered. There also are short-term insurance policies, and these will cover you up to a certain amount. So a lot of people think, oh, I'll pay an extra $2 grand, then I don't have to worry. Well, not exactly, because they may cover up to $20,000 of cost, or $40,000 or $50,000 of cost, but they don't necessarily cover every last dime, and God forbid you're in that tiny fraction of patients who have a devastating complication after surgery and a very prolonged hospital stay. Those bills can be hundreds of thousands of dollars. So while these short-term policies are excellent add-ons to any self-pay program, they're not exactly perfect. Aftercare. So aftercare is critical to your long-term success, and any self-pay program has to be set up. At the very least, the program should have affordable aftercare costs. If it costs you $250 every time you see someone in the practice for even 15 minutes, that's a little unreasonable, and it's likely that you're gonna be like, well, it's not worth $250 for 15 minutes. In our program, we have a very affordable cost for anybody who doesn't have coverage for office visits, and I think it's a reasonable amount. We also offer different packages, so if you want to meet with me after your surgery and have all of your aftercare performed by me, that's one cost, and it's a little higher than if you're meeting with my nurse practitioner. Is telemedicine available? This is especially important if you're going to travel. And it also is important that you have some plan for local support. While it's unusual that you're going to have something that really requires someone local, it is something that you should figure out. And then I think also, how much support do you want? I mean, is this something that you really want a lot of aftercare? Is that something that's really important to you? Or are you someone who's like, yeah, you know, I'll figure this out. I like YouTube videos, I got some books, and I'll kind of figure this out on my own. I don't really need a ton of face-to-face support for my surgery program. So again, this is something that's going to be individualized, and if it's not important to you, then you don't necessarily have to include that in your price or in your shopping. If it is included, then you should figure that out. What about travel? So it's not safe for everybody to travel, and I think that's an important thing to recognize, is that, and some of the worst problems I've seen were completely and totally predictable because the patient was absolutely not someone who should ever be traveling for weight loss surgery because they were very high risk. And when you travel, that increases your risk even more because that safety net that is generally in place is disrupted when you travel. As soon as you leave the institution, you're no longer somewhere that you can drive or present to the local emergency room. You're going to lose that safety net. So I think people who are under 65 years old who have either no health conditions or very well controlled health conditions, for instance, high blood pressure well controlled on one medication, who are able to walk a quarter mile without difficulty, who've never had any weight loss or gastric surgery, are choosing a sleeve gastrectomy and have never had a blood clot, a DVT or pulmonary embolus. These people are very low risk, and I think traveling, honestly, even to a high quality program in Mexico is not unreasonable. The group who absolutely should not have surgery are anyone over 65 years old if you have poorly controlled health conditions. For instance, your hemoglobin A1C is 10 or 11, which is very high and an indication that your diabetes is not well controlled, who you can't walk a quarter of a mile, who are having some form of complicated revision surgery or having a duodenal switch or a SADE procedure. I think you have to be very, very cautious. And this is a group of people who I would strongly caution against traveling for surgery. And then there's a group in the middle who, it depends on your risk tolerance, it depends on some of the nuances, who may have some health conditions that are getting a little bit worse, who can walk. To me, walking a quarter mile without difficulty, that really is pretty critical for you to be able to do this safely. Maybe having a revision surgery, but it's a band revision or a sleeve to a bypass, which generally presents a little bit additional risk, but not a ton. And especially if you're going to a really trained, skilled surgeon, then you may actually offset that increased complication rate from traveling by seeing someone who's really experienced in doing revision surgery. Someone who's having a gastric bypass, again, I think I'm a little less comfortable with gastric bypass patients traveling. It depends on the distance, it depends on where they live. Do they live in a remote area with little access to healthcare, or are they in the middle of a big city surrounded by a bunch of programs who just unfortunately have very high self-pay rates, and so they're traveling for a lower rate. And so God forbid there is a problem, there is a safety net in place for them in their city. Also, I think if your risks are a little bit high, you have to be willing to stay in town a little bit longer. And that's something you should also discuss with your surgery practice, is how long should you be willing to stay in town? What are the accommodations that are available? Who's going to be with you? How is that all going to work? It has to be planned out in advance, of course. So it's a lot of information about self-pay surgery. We have our self-pay information on my practice's website at TucsonWLS.com. I have information on PoundAcureWeightLoss.com. In my second book, How Weight Loss Surgery Really Works, I also have some information about self-pay surgery. So I hope that's helpful for all of you who are out there considering self-payment options for your weight loss surgery.